My name's Anne-Louise Shocker. I'm a consultant geriatrician on Ward 52, which is a 24-bedded acute medical and mental health unit for older people. About a year ago, I wondered what would happen if we moved away from a traditional model of consultants visiting a ward twice a week to see their patients to one modelled on compassionate and inclusive leadership. I wondered what the impact would be if, alongside the ward leader, I had a role in setting the vision for the ward and creating a compelling story for all of the staff to understand their individual role and contribution to, and they have a voice in. This wasn't about creating a huge amount of time on the ward as a consultant outside of ward rounds, but small touch points every day to talk to staff, be visible and help set the tone and culture. What we found was this had a positive impact on the patient's journey through acute care, that patients got home sooner, were empowered in shared decision making, that staff felt more valued and part of the team. It had a positive effect on staff well-being, safety and engagement.
So our approach initially was to really try and move from a twice weekly ward round with daily board rounds to more of a daily consultant-led focus. And alongside of that was the vision to look at maybe doing some of the virtual NDTs with our partners and also be inclusive with our therapists and use some of the compassionate leadership skills that as a trust we were trying to deliver on within our values. And it was part of a QSIR project of one of our lead consultants, and we wanted to test whether or not it improved our length of stay and enabled us to get patients home sooner and more safely. And so we started to undertake the project, and it had far-reaching results than any of us could have ever imagined.
The method that I used alongside the compassionate and inclusive leadership was using my CUSA training to actually measure, as we implemented the model on the ward, what the outcomes were, and using PDSA cycles as other members of the team joined in with the work and changed their working practices. And we used statistical analysis to analyse the findings and show there was significance in the improvements that we made. We've invited some of our staff to tell you their stories of what it feels like to be part of this team.
Our team is really, really good fun. Always feel involved as part of the team. Everybody has a voice. Love working here, love coming to work, and I love my colleagues. So we always do activities with our patients. We always make them feel included in their care, and family get involved with discharge planning.
Doctors are so easy to approach, and if you've got any queries or questions, they're happy to help. Same with the nurses, and same back when they come asking how certain patients been today. Always give them what it is, and if I'm not sure about stuff, I go up and ask them, and they're very helpful. So it's good to work in the team.
So everybody's contribution going forward and chatting to each other helps the patient have a smoother discharge. It's planned a lot sooner, days in advance.
For myself, being an F2 on geriatrics, initially I was really apprehensive about starting my job as on geriatrics, but personally I feel like it's been the best 8 months possible, and I think I've had the best experience. Reason being, you've all been dead supportive of me, and I feel like my confidence as a doctor has massively grown, and you've allowed me to be independent by just like being really dead supportive of my decision making, giving me really good feedback throughout the 8 months. And for myself, I just feel like found my love of Jerry's, which I never thought I would do, and I think that's just simply because the team's been fantastic.
Seeing the positive impact on staff and patients by using this model of leadership It has been an absolute privilege watching the team grow and flourish and find their voices in contributing to patient care. To be able to demonstrate shorter lengths of stay so people are getting to their homes quicker, with better outcomes, better safety, by really happy, well engaged, well staff, is hugely rewarding.